Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. The decision of other major countries to keep travel open was one of the great tragedies and missed opportunities from the early days. The WHO's attack on travel restrictions put political correctness above life-saving measures. Since its establishment in 1948, the American people have generously supported the World Health Organization to provide better health outcomes for the world and, most importantly, to help prevent global health crises. With the outbreak of the COVID-19 pandemic, we have deep concerns whether America's generosity has been put to the best use possible.
So President Trump recently cut ties with the World Health Organization. And if you're like most people, you're probably wondered, is that a good idea? Especially during a pandemic? What do they do for us anyways? I'm Dr. Leyla, Red Pill Pharmacist, and I'm the author of Off Balance, The American Way of Health, a pharmacist's perspective on why drugs don't work. And I'm going to share why I believe President Trump made the right decision. But let's take a look at the World Health Organization and see what they're about. For a little history, the World Health Organization was founded in 1948. Initially, their priorities were malaria, tuberculosis, venereal diseases, plus women and children's health, nutrition, and sanitation. Let's take a look and see what they do today. Again, the WHO works worldwide to promote health, keep the world safe, and serve the vulnerable. Our goal is to ensure that 1 billion more people have universal health coverage. They want to improve access to essential medicines and health products, and also for health emergencies. They prepare for emergencies by identifying, mitigating, and managing risk, and they prevent emergencies and support development of tools necessary during outbreaks, like the coronavirus. So these are the services they provide in general. Now let's see where they get their funding from. So here's where they talk about where they get the finance and accountability. You can see here, this is for the year 2016 and 17, but you can see the United States of America is by far the biggest contributor, contributing $900 million between 2018 and 2019. The second one is the Bill and Melinda Gates Foundation. And most people know he's an investor and big promoter of vaccines. He's interviewed all over mainstream media and was on the Ellen Show sharing his thoughts about vaccines and how he explains the world won't go back to normal until everyone is vaccinated against the coronavirus. So vaccines are a big part of his agenda. Number 3, United Kingdom of Great Britain and Northern Ireland. Number 4 is the GAVI Alliance. Now, what's the GAVI Alliance? GAVI is an international organization created in 2000 to improve access to new and underused vaccines for children living in the world's poorest country. Okay, another one that pushes vaccines, but look over here. Founder is the Bill and Melinda Gates Foundation. Very interesting. And if you go to the website, right on the front page, it says the world urgently needs a vaccine against COVID-19 to minimize the devastating impacts of the virus. GAVI is committed to ensuring that all countries get equal, rapid, and adequate access to them once available. So you can see they're really excited to get this vaccine out in the world to this deadly virus where people recover 97 to 99% of the time. So GAVI Alliance, founded by Bill and Melinda Gates, is number 4, and number 5 is Japan. So you can see the top funder was the United States of America, and then half of the other contributors are basically Bill and Melinda Gates, donating as the Bill and Melinda Gates Foundation, and then donating as the GAVI Alliance, which was founded by the Bill and Melinda Gates Foundation. So now I'm going to share why I agree with Trump that cutting ties with the World Health Organization was a good decision. And the first one Trump explains in this video, I'm not going to play it here, but if you want to watch it, I'll put the link below. But his main points, he said, when Trump initiated the travel ban from China, the WHO didn't agree with it. And it turned out to be a really good idea, and it saved lives. He also said other countries that didn't ban travel as early, they paid for it with a lot more cases of the coronavirus. Trump also said the WHO didn't obtain and share information in a timely or transparent fashion, and they failed to investigate credible reports from sources in Wuhan that conflicted with the official reports of the Chinese government. Then Trump reminded us the United States has supported the World Health Organization since it started in 1948. Has America's generosity been put to the best use possible? So according to President Trump, the World Health Organization failed at their initial response to the pandemic, and he gave his reasons. An emergency pandemic like this is one of those things that they should be most prepared for. But besides the initial response, what is the World Health Organization recommending for the treatment of coronavirus? Well, let's take a look. When I get to the page from the World Health Organization on coronavirus disease, advice for the public, I don't see anything on treatment options here. Protect yourself, wash your hands, wear a mask, don't be in crowds, don't touch your eyes. Typical stuff here. But I didn't find anything about treatments until I hit on Mythbusters. And it says here, while several drug trials are ongoing, there is currently no proof that hydroxychloroquine or any other drug can cure or prevent COVID-19. The misuse of hydroxychloroquine can cause serious side effects and illness, and even lead to death. Well, guess what? The misuse of any pharmaceutical drug can lead to serious side effects and illnesses. So that's meant to make you even more scared of it. There are currently no drugs licensed for the treatment or prevention of COVID-19. License, that's an interesting word too. Since when does a drug get licensed? So let's take a look at hydroxychloroquine and how it's used right now. And again, in recent videos, I shared where there's several doctors who spoke up and said that they were using hydroxychloroquine after President Trump recommended it, and they said they were getting really great results. People were recovering quickly when using it. So then I did a search for hydroxychloroquine. Why was the use of hydroxychloroquine stopped in the Solidarity trial? Both showed that hydroxychloroquine did not result in the reduction of mortality of hospitalized COVID-19 patients when compared to the standard of care. Okay, so it didn't work initially, so they stopped it. Now again, looking back at hydroxychloroquine, it's been around about 60 years, and it's used regularly for patients that have rheumatoid arthritis and lupus. But let's take a look at the Lupus website here. This is lupus.org. It's a national resource center on lupus, and I looked up hydroxychloroquine there to see how they're using it. Now, as far as the benefits, it says it decreases the number of disease flares, strong evidence, especially with HCQ, of decreased lupus activity during pregnancy without harm to the fetus, strong evidence of prevention of disease flares, strong evidence of increased long-term survival, moderate evidence of protection against irreversible organ damage, thrombosis or blood clot formation, and bone mass loss. Side effects include gastrointestinal problems, nausea, vomiting, upset stomach, cramps, diarrhea, loss of appetite, tiredness, weakness, headache, and a more serious but rare side effect is a retinopathy. So the greatest concern when taking hydroxychloroquine is related to vision. Although it's rare, they monitor the eyes to make sure that doesn't happen. But now look at this section they have on the future. It says hydroxychloroquine was previously prescribed only for people whose lupus disease activity was mild in its course. If lupus became active, steroids or immunosuppressants would be prescribed. Instead, however, hydroxychloroquine is recommended for most individuals with lupus, whether mild, moderate, or severe, as well as during pregnancy and while breastfeeding. Given the drug's many and varied beneficial effects and its excellent long-standing safety profile, most rheumatologists believe that hydroxychloroquine should be taken by people with lupus throughout their lifetime. Annual examinations with a qualified retina specialist are strongly encouraged, however. Again, this has been on the market for 60 years, and that means that the effects as well as the side effects are known. And it's recommended for lupus patients, not for a week or a month, but throughout their lifetime. So again, for the coronavirus, a patient would take it for a week or maybe 2. Some may want to take it longer to prevent it. It's already proven to be very safe in populations that take it for many years. And again, most people recover from the coronavirus without any treatment, 97 to 99%. But for that small percentage of patients who are immunocompromised or at risk for whatever reason, then why not give a drug that is shown to be safe for long-term use, especially when the so-called medical experts have nothing else to offer? And again, these trials are done to prove that they're safe and effective. We already know the medication's safe. And a handful of medical doctors have spoken up, and there's some studies that have gone on that show that it's effective. So why isn't the WHO suggesting this for patients that need something now? Why are they throwing this under the rug? If you have something that's inexpensive, safe, and might work, then that's enough. You don't need to wait for tests. This is something we would just try to give someone when there's nothing else. Why isn't the World Health Organization recommending an inexpensive, safe medication that might work? Because their first priority is not the health of the people. Their first priority is to the donors and the contributors who prioritize pharmaceutical drugs and vaccines. They're just another organization that's got complacent, taking our money and no longer serving our best interest. Again, the World Health Organization top funders promote and sell vaccines. That's why they're not sharing these simple solutions that might help that small percentage of people who need it. So the World Health Organization failed at their response to the pandemic, and they're not promoting a safe drug that is shown to have some beneficial effects. In fact, they go a step further and say the misuse may cause serious side effects and illness and even death. But what about regular health conditions that we are dealing with every day? So I went to the health topics section just to look at a couple of the disease states and see what they have to say about it. So I looked up diabetes because that's such a common one. So in the diabetes section, it basically has an overview of information. And it has some key facts and statistics here. There's an overview of what it's about. Type 2, type 1, and gestational diabetes. And the health impact. What is your life going to be like if you have diabetes? On the diagnosis and treatment, it says basically diet, physical activity, and lower blood glucose with medications. Nothing that's really cutting edge. It doesn't mention that a plant-based diet, like recommended in the book The China Study, can practically reverse diabetes, or how intermittent fasting can help. It's very basic, traditional information that you get. But then I found a link to this page, and you can see it's typed up. And it has a binder hole on the left there. This is the 42nd World Health Assembly, dated May 19th, 1989, and they're working on the prevention and control of diabetes. And here it says, diabetes is a chronic, debilitating, and costly disease, represents a significant burden on public health. So they acknowledge all that back in 1989. And down here it says that they're working to establish a model for the integrated approach to the prevention and control of diabetes at community level. This is dated May 1989. Again, so they knew it was a problem back then. And how are we doing today? Well, if you look at their own statistics, the number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. So that's about a 4 times increase in the number of people. So I think we can safely say they haven't done a good job in preventing diabetes in the past 40 years. And the final point I want to make is just one observation. When I look up under health topics nutrition, it says nutrition is a critical part of health and development. Better nutrition is related to improved infant, child, and maternal health, strong immune system, safer pregnancy and childbirth, and a lower risk of non-communicable diseases. And healthy children learn better. People with adequate nutrition are more productive and can create opportunities to gradually break the cycles of poverty and hunger. So that's pretty basic information. Nutrition is important. It's a critical part of health and development. But look at this part here. when they describe the vaccines and immunizations. Immunization is a global health and developmental success story, saving millions of lives every year. Vaccines reduce risks of getting a disease by working with your body's natural defenses to build protection. When you get a vaccine, your immune system responds. And down here, immunization is a key component of primary health care and an indisputable human right. It's also one of the best health investments money can buy. So you see how they're much more excited about vaccines than they are even about nutrition? Nutrition is critical, but this is one of the best health investments money can buy. What if they talked about nutrition like that? This is one of the best health investments money can buy. So in summary, Trump's decision to stop funding the World Health Organization was, in my opinion, a great decision for the American people. The World Health Organization is just another organization that takes our money, and it stopped working in our best interest long ago. Besides their failed response to the pandemic, they ignore simple and inexpensive ways to improve our health, and instead they're an extension of the pharmaceutical companies as they help to promote expensive pharmaceutical drugs and vaccines. I'm hoping that the money that we're now saving on the World Health Organization will now go to other groups or organizations that are really interested in teaching and promoting true health. And I also hope that this is the start to reviewing many other groups and organizations that continue to take our money, but no longer serve the American people. I suggest we look into the CDC or the FDA next. I'm Dr. Leyla Ali, the Red Pill Pharmacist. Thanks for watching.